Hi, and welcome to this month's newsletter. And it's been a very interesting month. We've covered quite a bit of territory again. It's a broad brush we used this last month. We spoke to Professor of Public Health Grant Schofield about how are we doing, and we learnt about and talked about acceptance and commitment and resilience and building all of those things into our lives. It was a really interesting discussion. I always enjoy catching up with a professor of public health, and Grant is always good to talk to. Then I spoke to integrative holistic practitioner, Dr. David Brownstein, who has written so many books on so many subjects around thyroid, around salt, around holistic healthcare, around herbal medicine. The links on his website are a feast. And in fact, they are books that are very accessible to the public, and I would encourage you to look at it. But we talked about thyroid function and iodine and viruses and much, much more. We covered a wide range of topics with David. He really was a wealth of knowledge. And then we revisited with Roger Price, a breathing therapist, breathing retraining therapist. And this followed on from the episode that we had with Professor Pete Smith, who is one of Australia's leading allergists. And we talked about allergy and asthma with Pete Smith, and he made the comment that 30% of asthma diagnoses are misdiagnosed because the actual procedure you use to diagnose it could actually bring on what looks like asthma. So when I had that episode, Roger, who I've spoken to before, he's a good friend, a mentor of mine, contacted me and said, Ron, that was actually an underestimation. He believes the figure is much higher than that. And I'll leave it with you to explore that episode where we asked the question, do you really have asthma? And it was a really interesting conversation, which I thought was worthwhile. Now, then came the last episode of the month with Dr. Philip Altman. And Philip I met at a lunch a few months ago, and as soon as I met him, I wanted to share him with you, with my listeners. And Philip has spent 40 years, or his entire professional life, working in the pharmaceutical industry. He had a company that pharmaceutical companies would approach to get their products approved in Australia in the TGA. So Philip is very familiar with clinical trials, with the workings of the TGA, and it was such an interesting discussion. And when I asked Philip to join me, he gave me the title, if you like, of the podcast called COVID Misconceptions. Now, if you go onto my website, we may or may not change this, but the original episode was called COVID Misconceptions. And this was Philip's own suggestion, because that's what he was going to do on this episode, and that was deal with misconceptions. Now, I'll touch on those misconceptions in a moment. Let's talk about them first. The first misconception was the way the so-called experts predicted what the potential death rates were going to be for COVID. And in Australia, that figure was something like 150,000 people were going to die of COVID. And when the pandemic was unknown, and we really didn't know what we were dealing with, one could argue that shooting for the high number was perhaps appropriate, and it was that high number which stimulated the chief medical officer in Australia to declare an emergency, and that led to lockdowns, which every one of us is very familiar with. So the first prediction in Australia was 150,000. In America, it was 6 million. I think in the UK, it was 2 or 3 million. And those predictions by these so-called experts was wildly wrong. First misconception. The second misconception was the use of PCR tests. Now, even the inventor of PCR tests said clearly at the beginning of the pandemic, he has since died, unfortunately, but he said that PCR tests were not designed to pick up viral infections, and yet they have been the mode by which we have done that. Another misconception is deaths of COVID, from COVID, the difference, and Philip talks about the difference between dying with the infection and dying from the infection was significantly different. And I touched on this with a guest I will be in the next month or two with Dr. Stephen Park, an ENT specialist who was working at the front line in intensive care in New York. Now, we all saw images of New York and it was terrible, but Stephen worked at that front line and he was shocked by what he saw. And I don't want to diminish the fact that COVID is a serious infection, particularly for those that are old and infirmed and who have comorbidities. I don't want to detract from that. It is a serious infection. And even if you're not old, but you have comorbidities or a compromised immune function, then it potentially is serious too. But dying from COVID and dying with COVID were two very different things. And what Stephen observed in New York was, even when people were brought in car accidents and died, if they had COVID, they were listed as a COVID death. Now, it's worth pausing at that point to consider that, the difference between dying with COVID or from COVID. People who were in palliative care, dying of cancer, were listed as, and then died of cancer with COVID, but not from COVID, were listed as a COVID death. Why? Because the government was paying hospitals a subsidy for every COVID patient that they had. And so Stephen, who had been in practice, has written books, Sleep Interrupted. We talk about it in the upcoming podcast in the next month or two. Stephen, who had trained as an ENT specialist and had been in practice and had taught academically for over 30 years, decided to leave the profession because he found the way the public health officials dealt with this problem was unconscionable. And yes, he was there at the front line dealing with the problems that emerged, but was so shocked by the way this was being dealt with on a public health level that it was incredible. And Philip, who has also been at the center of the pharmaceutical industry, went on, apart from the PCR tests and apart from talking about the difference between dying from COVID or with COVID, then went on to talk about another misconception, that the vaccines were effective and safe. And one can I think we should all remember the leader of the free world, Joe Biden, the president of the United States, getting up and saying, if you take the vaccine, you will not get COVID. And actually, vaccines, in my experience, and I'm most definitely not an anti-vaxxer, but when I've had smallpox, polio, hepatitis, typhoid, yellow fever, whooping cough, a vaccine gave immunity from the disease that it was being given for. So we now know very clearly that vaccines do not prevent disease. The second one about efficacy. Many people, of course, get it should be said that it does prevent deaths, probably for people older, and reduce their risk of getting deaths. It's worth remembering that your chance of dying of COVID is 0.04%. That is your chance of dying of COVID. So your chance of not dying of COVID is 99.96%. Your likelihood of not dying from COVID. Now, I've asked many friends this question, what do you think it is? And the estimations have ranged from 2% to 5% to 10%, and one person even told me 50%, which of course was absurd. But 2%, 5%, 10% would not be a common misconception. The reality is it's not 2%, 5%, or 10%. Your chance is 0.04%. The next question was, what is the average life what is the what is the age of a person who have died? What's the average age of people who have died of COVID? Now, that's an interesting question to ask, but the answer there is 86 for women and 82 for men, which is not that different from life expectancy in Australia. Another misconception. Then we talk about ivermectin as another misconception, and I've covered this topic often enough. So it was an extremely important and interesting conversation, and Philip also introduced me to three types of science, which we then argued about. The first was classic science, which he prides himself on having read throughout his professional career from journals like Lancet and New England Journal of Medicine and JAMA and the British Medical Journal. And there is junk medicine, which is clearly and obviously junk, and there is now scientism, which is through public health prognostications, it's just accepted as medicine. So we talked about whether actually classic medicine was really not part of junk medicine and scientism as well, because it is now well documented that 85% of the science in medicine is unreproducible. 85% of the science in medicine is unreproducible. And I make the point that there are some groups, and many of them are leading public health officials in Australia, that without any hint of irony call themselves the friends of science in medicine. Now, if they were being honest, they would call themselves the friends of big pharma. And if they were being honourable, they would call themselves the scrutineers of big science in medicine. But no, without a hint of irony, they call themselves the friends of science in medicine, even though 85% of the science in medicine is unreproducible and is almost exclusively funded by the pharmaceutical industry. We called the episode COVID Misconceptions. When it went up on YouTube, it was pulled down. So it was the first time, and I've made various episodes, The Elephant in the Room, perhaps that didn't attract people's attention, or Trust the Science, ? Or The P's of the Pandemic. Clearly that didn't attract attention, but COVID Misconceptions was, as of August 2022, too much for YouTube to accept, and was taken down. It's since been republished under a different name. Anyway, it's been a big month, and it's a big month ahead, and we are about to launch Unstress Health. So that is going to be a feast of extra knowledge, extra resources, which we're really excited to share with you. Hope this finds you well until next month. This is Dr. Ron Ehrlich. Be well.